back to Winning Isn't Easy. Let's talk about mental health disorders that remain medically disputed or controversial and their impact on your ERISA disability insurance claim. The first condition is dissociative identity disorder, DID, and it involves the presence of two or more identity states with gaps in memory. I actually represent a policyholder in both her disability and Social Security disability claim, and there are 7 alt personalities, and we deal with each one of these personalities. Unfortunately, the Social Security judge denied her claim, notwithstanding the presence of those alts during the course of the hearing. We took that up to the Appeals Council. The judge has been reversed, and we're going to have another hearing. And at the hearing, I am sure that the alts are going to be present. Now, for long-term disability purposes, I find that the carriers can challenge both the diagnosis and its impact on occupational functioning. These cases rely on comprehensive and significant psychiatric evaluations, therapy notes, and detailed accounts about how the DID episodes interfere with the job responsibilities. And in the case I'm referring to, my client worked in the insurance industry, and she had difficulty focusing, managing, dealing with deadlines, interacting with colleagues, because the alts would come out at all different points, depending on how stressful her work would be. And you can imagine that just threw the employer for a loop, and ultimately she lost her job. But these symptoms can materially impair the work performance, and demonstrating that is absolutely critical. There's also adult ADHD. It's somewhat controversial. Symptoms can include distractibility, inattention, and difficulty with organization. In a long-term disability case, the insurers are often looking for objective testing, workplace accommodation, and documentation of functional impairment. And that functional impairment really comes in the form of an impact on the ability to perform the essential duties rather than creating an inconvenience. From a Social Security standpoint, I will tell you that you're not going to win an ADHD Social Security claim if that's the only issue. Social Security does not take it seriously, and quite frankly, I don't think disability insurance carriers take it seriously either. It's the combination normally of other medical problems that will win the claim, not the ADHD. Well, how about post-traumatic stress disorder in non-combat settings? It's well recognized in combat settings. It can be disputed when it arises from workplace trauma. Symptoms can include hypervigilance, flashbacks, and difficulty sleeping. Now, when I have these kinds of cases in the context of a long-term disability case, what we normally will see is post-traumatic stress disorder secondary to workplace harassment, sexual discrimination, or other issues in the workplace. And often disability carriers try to paint this as an employment dispute, not a psychological dispute, when in fact they can be both. It's really important to have therapy notes, psychiatric evaluations, and real-world examples of work impairment, such as the inability to attend meetings, meet deadlines, maintain concentration. And we also want to address triggers. Being in the workplace, being with a certain employee, being exposed to certain individuals that they may have to deal with, particularly in a sales setting. Those are things that need to be documented. What is the trigger? Why does it trigger? What does it trigger? How long does this episode last when triggered? How does it impact the person's ability to function? So you have to establish the triggers and the connection with what the trigger results in and the connection between the trauma and the functional impairment. Again, that needs to be documented significantly by medical documentation, and we try to get narrative reports from the treating psychiatrist or psychologist documenting the extent and nature of the post-traumatic stress disorder, triggers, how those triggers cause symptoms and impact functionality, and then tie it together on an objective basis. And then there's the somatic symptom disorder, which involves persistent physical complaints with no clear medical explanation. Patients and policyholders can experience excessive thoughts, feelings, and behaviors related to the symptoms. I will tell you that disability carriers and plans will scrutinize these claims. The scrutiny is just amazing. They question whether the symptoms are genuine or severe enough to prevent work. And as with mental health claims, they want documentation from treating physicians, functional assessments, and real world examples of limitations that can substantiate the disability claim. I promise you that their liar for hire doctors will say that this does not rise to the level of causing significant restrictions and limitations in the workplace. Yes, you might have these persistent physical complaints, but they're not real. They're all psychological, and benefits potentially are limited to just 2 years. Or if there's a subjective medical condition limitation in the policy, they will argue that because there's no organic physical issue, this is all subjective, and alternatively, benefits are limited to just 2 years if we can't apply the mental nervous policy limitation. These are difficult cases to win and require extensive documentation and proof. So for disputed mental conditions and long-term disability, I think you need to understand that they are focused less on whether the diagnosis is universally accepted and more on whether those symptoms materially impair the person's ability to perform the material and substantial duties of their occupation or essential duties. It is really crucial that we have detailed documentation of the functional limitations, an objective basis for those functional limitations, therapy records that are replete with a really good history of the symptoms and functionality, and psychiatric assessment with the support of a psychiatrist. It's just essential for navigating these kinds of claims with disputed diagnoses. Got it? Let's take a break.
Are you a professional with questions about your individual disability policy? You need the Disability Insurance Claim Survival Guide for Professionals. This book gives you a comprehensive understanding of your disability policy, with tips and to-dos that will assist you in submitting a winning disability application. This is one you don't want to miss. For the next 24 hours, we're giving away free copies of the Disability Insurance Claim Survival Guide for Professionals. Order yours today at disabilityclaimsforprofessionals.com.